Breastfeeding can save parents thousands of dollars per year. The cost of formula alone for the first year of an infant's life can exceed more than $2,800. This figure does not include the cost of bottles, a sterilizer, or anything else you need to bottle feed. Many new parents have done some sort of research on breastfeeding and formula. Unfortunately, not all parents have a thorough understanding of the benefits of breast milk. For the first 14 months of my son's life, I nursed him. He was never fed any formula. I was able to see firsthand the cost savings and health benefits of this choice. Choosing to nurse my son was one of the best choices that I could have ever made for him. That one choice will continue to positively affect him for the rest of his life. Today, I ask you to listen as I discuss the health benefits for the child, the health benefits for the mother, and the comparison of various costs associated with formula versus breast milk. The American Association of Pediatrics recommends breastfeeding exclusively for the first 6 months of a baby's life, and then combining food and breast milk until the baby is at least 12 months old. However, formula is an alternative if breastfeeding is not possible or is not what the mother chooses. Following these recommendations have shown that exclusively breastfed babies are more protected against various diseases and illnesses. The nutrients in breast milk can help protect babies from allergies such as eczema, asthma, and atopic dermatitis. It also helps protect against anemia, sudden infant death syndrome, reduces the rate of vomiting and diarrhea, gastrointestinal disease, respiratory infection, and ear infections. When breastfed for at least 1 year, various studies have shown that babies are less likely to be hospitalized if they become sick. There are also various positive long-term effects of breastfeeding for infants. Breast milk can prevent or lessen the effects of childhood cancer, diabetes, heart disease, multiple sclerosis, and asthma. If a mother chooses not to breastfeed or is unable to, formula is one option to replace breast milk. Feeding an infant formula from a bottle can give the whole family a chance to bond with the baby. Formula-fed babies do not have to be fed as often because formula is harder for infants to digest, so it stays in their stomachs longer. One of the biggest disadvantages to formula is the fact that it lacks the antibodies that are present in breast milk. Now that you know the benefits of breastfeeding for babies, I will tell you about the benefits to the mother. Although there are not as many health benefits to the mother as there are to the child, where breastfeeding is concerned, there are a few ways that mom can benefit. Breastfeeding can lower the risk of diabetes, certain types of breast cancer, and ovarian cancer. The emotional bond that is created through nursing is another benefit not only to the child but to the mother as well. Breastfeeding can also be easier on new mothers when compared to formula feeding. Breast milk is readily available. It's usually incredibly convenient, and the baby can be fed whenever, wherever. Formula can be difficult. Each bottle needs to be measured and heated. When the bottle is finished, it needs to be sterilized. There are many different ways to compare the cost of breastfeeding versus formula feeding. There's the cost of the formula itself, the savings in healthcare costs, and even an emotional cost. The cost of formula can be incredibly high, depending on the brand the parents choose to use. When in the hospital, if a mother chooses to formula feed her baby, the hospital will sometimes give free samples of formula. This can sometimes cause parents to spend more. The reason for this is because the name brands are given out in the hospital, which tend to be more expensive. It can be hard to transition infants to a different formula, so parents usually just stick with the more expensive brand. According to the Florida Breastfeeding Coalition, formula can cost between $1,300 and $2,800 per year. This is only the cost of formula and does not include the cost of bottles, a sterilizer, or any other products. If a mother chooses to breastfeed exclusively without having to pump or save milk, it's free. The cost of breastfeeding is limited to the cost of a few bottles, storing materials, and a breast pump. However, there are many insurance companies out there that will either purchase or reimburse the cost of a pump. There are many significant healthcare savings that can be associated with breastfeeding as well. The annual cost of not breastfeeding is between $1.18 billion and $1.3 billion per year. The costs included in these numbers are office visits, hospitalizations, drug prescriptions, treatments, and hospitalizations for RSV, diabetes, infant diarrhea, and other diseases and illnesses that could be prevented. Every year, conservatively, $4.18 billion could be saved if more mothers breastfed their babies. The costs associated with this number would be a reduction in childhood cancer, a reduction in childhood diarrhea, ear infections, diabetes, and hospitalizations due to RSV. The emotional cost of breastfeeding is one that I wouldn't want to experience. The bond that is created through breastfeeding is one that cannot be replicated anywhere else. In closing, the benefits of nursing vastly outweigh the benefits of formula feeding. Choosing to breastfeed will not only help the mother and baby in the short term, but provide lasting health benefits to both as well. Parents need to be well educated about the benefits of breastfeeding to the mother, the child, and the costs associated with formula and nursing. The choice that parents have to make about how to nourish their children can be a difficult one. I believe that if more parents knew the benefits of breastfeeding, more parents would choose to do it. I hope that you all agree that breastfeeding is the best option for infants.